look over here, all these little pinpoint scars. What happened with these guys is that they're very, very deep, and they destroyed some of the fat, especially in this temple area. So there's not much fat here in the first place. These little scars, they killed that fat, and now it's caused a lot of volume loss here. How old are you again?
30.
30, okay, yeah. So, premature volume loss because of the acne scars. Of course, you have scarring over here as well. And these ones, you look at it this way here, what happened is that they chewed up this fat right here in the mid-cheek pad right here. And if you look and you stretch out that skin, you see this guy right here. Look at how you stretch it out. These are stuck scars that we have to go underneath that tissue and really break up. So a lot of the things that we have to do is actually that manual work. We're going to actually also place some TCA, the acid, to help stimulate collagen production. Some of these things will get some improvement right away, but some of these things are going to take months and months and months, 6 months out, even 1 year out. You'll start seeing that improvement because it's just a slow process for that collagen response. And the TCA is sometimes something we want to repeat. So take a look, you can see again, similar process. Unfortunately, these little ice pick scars really chewed up the temple area a lot. The cheek area really gotten rid of a lot of the fat. Look at how stuck it is right in this particular area, and that amount of volume loss that occurred right here. See that? Look at that volume loss. And as you stretch out the skin, you can see how the scar is just shifting with the skin. So it really is stuck. We're gonna have to go in there and really break it up. This is a case that I do have to use a few different tools likely to break up some of the scar tissue because it seems like it's pretty stuck there. You see again, same type of process up in the forehead. So all these little pinpoint ones. So here's the thing. So for the temple area, one of the best things to do is actually Bellafill. We're gonna use Bellafill because it's a long-lasting permanent collagen filler, and it continues to make collagen in that area, which is really valuable for an area like the temple, where as you get older, start losing volume, and you see those scars. In this particular area, you're not going to be able to reconstruct the scars with laser as well. It doesn't matter what anybody tells you, really. The truth is that it's too thin of an area. There's just not much tissue there. You could break down the walls a little bit, smooth out the edges, but there's only so deep that you're going to be able to go with a laser before you start going to fat and muscle. Using an acid like TCA and using Bellafill is going to be really valuable for us. Sort of similar to the forehead area over here. The forehead, what happens over here is that when it chews up some of this fat, there's not that much reserve. There's not too much fat here in the first place, so it really does eat it up and kind of cause a little bit premature volume loss. And you can see for this particular patient where it's good volume up over here and then it drops down really rapidly. And now the skin itself is a lot looser over here. So somebody like him who's 30 years old, it made premature aging. So essentially now we have looser skin already. All right, Daniel, so I got a good game plan here. What we'll do is we'll do TCA. Okay, we'll place that acid at the base of each of these scars. We're gonna actually do in the forehead, we're gonna do as well a little bit of filler over here, because you could do a little bit of subcision there, space it out, place a little bit of filler. It works really well. We'll do Bellafill in the temple area, and then we will do also some acid, of course, in the temple area as well as the cheeks, and subcision, go inside and break up that scar tissue, and then we'll do laser to resurface around over here. A lot of these scars really destroyed fat. You're a great candidate because your acne's under control too. You're perfect for what we need to do. Really, which is just never going to be like a single type of thing. It really needs multiple different things to be able to do like this to fix this. But we'll start with the first process, which is going to be the acid, the TCA, and then we will also do a little bit of that Bellafill to do some forehead ones. So I'll break it up, so break up these scar tissues as well, and then do laser on top.
All right, sounds good.